Hi, if you're suffering from bloating, pain, cramps, diarrhea, constipation, then this brief webinar will make sense to you. This is a digestive disorder webinar to give you information on the problems, causes, and solutions of digestive disorders. Digestive disorders consist of the problems with reflux, heartburn, irritable bowel syndrome, which basically means you alternate between diarrhea and constipation, inflammatory bowel disease like Crohn's or ulcerative colitis. Many of my patients that tell me about these problems, they tell me they've had them for years, some of my patients even decades, and they never ever thought they would get well until we put them on our natural, non-drug, unique approach. Now, many of these patients tell me that these problems now interfere with their daily life. They're afraid to leave the house. They're afraid to travel. They're afraid to go to parties. Every time they eat something, they either get burning or bloating. They're afraid that they're going to have an accident or soil themselves when they do dancing or travel on a plane. My goal is to help you get well. And the biggest difference is I address the root cause of the problem. Most of the time, you've been seeing doctors that treat the symptom. It's a common saying in functional medicine or clinical nutrition is we treat people and not disease. There could be 10 patients with irritable bowel syndrome that have 10 different causes. Each person could have a different cause of why they have irritable bowel syndrome or reflux or Crohn's disease. We look at you as an individual, not as a disease. Now, there are many factors that address the cause. Think of an iceberg. The tip of the iceberg is the name of your disease. The body is the cause. The body of the iceberg is the root cause or the abnormal physiology. I address the root cause of your problem. And there could be many factors. You could have an absorption issue, a nutritional deficiency, a heavy metal toxicity. You could have an immune system imbalance. You could have a hyperactive nervous system. You could have a leaky gut or intestinal permeability. You could have a detoxification imbalance. Each of these errors in physiology, each of these malfunctions needs to be addressed. Now, how do we address them? Well, we first have to assess you. There's very specific science-based testing that we do to determine. Now, I know each and every one of you has probably had lab tests or a colonoscopy. And I know 99.9% of the time your doctors have told you nothing's wrong. Well, I'm here to tell you, if you're having these symptoms, there's something wrong and there's things that were missed. Remember, I am an expert in health recovery and I treat the person, not the disease. So we look at the underlying cause of your problem. We leave no stone unturned. We address your problems from a neurological point of view and a metabolic point of view. Metabolic would be looking at your blood work, looking at lab tests, deficiencies, and toxicities. Now, if this information makes sense to you and you would like to find out if your particular problem will be able to get help from my unique approach of addressing the root cause and being comprehensive, then please give us a call at 248-615-1533 for a 30-minute consultation. Please bring in your lab work, all other testing, your colonoscopy results, and I will look over those with you. We'll sit down in a relaxed environment and we will discuss your case and see if you are a candidate for my unique, non-drug, holistic approach of helping your digestive system heal. Thank you. I'm Dr. Gregory Kramer. I look forward to seeing you at the office.